everybody,
Good
how are you
afternoon.
this week? This is the infant feeding team at the John Radcliffe Hospital in Oxford, and we are going to have about an hour question and answer session again, our weekly session, and we love to hear all your questions, little, big, problems, what you found helpful, what you found enjoying, and anything in between. We'd love to hear anything at all. And if you found anything helpful that we've talked to you over the last, I think, 12 weeks, feedback so that mums can be reassured that it does help. And, you know, the stuff that we've talk about your experiences to let us know and give feedback to other mums that are struggling still. That'd be really nice. We are in one of the side rooms on the other side of the hospital this week. We're going around all the different rooms. So this is one of the side rooms on level 5 on the postnatal ward. So we're hiding at the end of the corridor, having a little chat here today. So hopefully we won't get disturbed by tea trolleys or anything halfway through.
And we haven't got the bleep.
And we haven't got the bleep.
We've left
today.
the bleep in the office. So we'll answer any bleeps later.
Let us know if you can see us and hear us, and do start firing away with all your questions. What we'd like to talk about today is, I think, some of the things that dads can do when they have a newborn baby, how they can support mums that are breastfeeding, and things that you might find helpful. So it's not just about breastfeeding, and dads have got a huge role in helping with baby care. It doesn't have to be about feeding the baby, and I think it's about being able to make it as easy as possible for both of you. And seeing the reality of it is that you're both absolutely shattered, particularly in the first couple of weeks when the shock of having very little sleep hits you. So things like making sure that mum has got stuff in her by her bed, so things like tissues and a drink of water, tea or coffee, snacks to eat, and anything else that she might need that will allow her to be able to just sit and feed and be with the baby, which will be quite a lot of the time. And then, you know, if your baby wakes up in the middle of the night, you can change the baby if it needs changing, and then hand the baby back to mum. So dads or partners can, you know, get everything ready and set everything out and then hand the baby back. So that's a really lovely thing to do, and have a lovely snuggle with the baby that's just coming awake. Is really lovely, and that really helps the baby sort of calm. It doesn't smell the mum's milk quite so much if you're doing that, so it will be calm when you're changing the baby's nappy, and it'll be ready for a feed, and then you can hand the baby over, and then after the feed's finished you can do the same again if you want to, or you can just snuggle with your baby and help it go back to sleep by settling it. So, you know, that sort of thing is brilliant. Slightly change in roles, so you can think about things like, if in the early days, if you've got paternity leave or, you know, post-baby leave, then you can think about supper, and you could possibly think about making supper in the morning when you get up and putting it in the fridge for later on in the evening.
I think because evenings are very difficult, aren't they?
Yeah, so, you know, 4 o'clock onwards is a really challenging time for both parents. You know, if you've gone back to work as a partner, then you have been at work all day and you've done a full day's work, and when you come back in, you know, the first thing a lot of mums will say is that they look at me and think, well, what have you done all day? And it can cause quite a lot of conflict. So understanding the role of the mum is the fact that she probably hasn't managed to get out of her pyjamas till 1 o'clock, and she probably hasn't eaten properly all day. She certainly won't have had a shower in the early days, and she you know, she will be absolutely strained, because all she's done is fed a baby all day. That's literally what will have happened.
I can remember asking my husband to cut the bread in the morning, so we didn't have sliced bread, making my husband cut slices of bread in the morning so that I could put it down in the toaster with one hand, because I couldn't cut a slice of bread with a baby in my arms. So that was always his job. He had to cut my bread in the mornings. So.
And I used to greet my husband with a baby and a pint when he came through the door. I just, here you go, darling.
2 lovely things, your baby and a drink.
Yeah, soften the blow.
Yeah.
So, you know, you are shredded as a mum by the end of a long day, particularly if you haven't actually got out the house.
Mm.
So, thinking about working together, and, you can also sit down together and talk about what your expectations are each. So you can both sit down and write down what the most important things for you are about being a parent, and don't talk to each other, but just think about, maybe before you have your baby do it, and then redo it after you've had your baby, maybe once a week, and just write down things that are helping you and things that aren't helping you, and what you would like to happen and what is happening, and then look at both your answers and say, well, what is happening with us? So that you can open a two-way discussion all the time, because there can be an awful lot of tension between partners when you have a newborn baby, because it's an adjustment of roles, and you will come home from work and say, as a partner, I've been at work all day, and the mum will say, but I've done nothing but feed the baby all day, and I've got nothing else done, and the house looks a tip.
But that's such an important job.
It's such an important job. Feeding the baby is just so important, and you're setting down your baby's health for life with the care that you're giving your baby. You're nurturing it, you're growing your baby's brain, and you're giving your baby the best start for health and emotion for the rest of its life. So it's really important that your emotional health and your nutrition and everything else about you is right as well, for both of you as a couple. And to be able to talk about what your expectations are and what you're finding hard on a regular basis will stop tension building up between you when you're in that early start.
And those early months, then we talk about, that period of time when babies are very little goes past so quickly. And I think when you're in the middle of it, you can't see it as being quick. But if you think we're 6 months into the year, and actually I don't know about anyone else, but it feels like it's gone in a blur because of this, the way the year's
Why
gone.
Is it July so quickly?
Yeah, and actually these first these are the 6 months, and there would be mummies who had their babies just after Christmas, and now they're ready putting their babies onto solid foods, and weaning foods. So actually, that 6 months for many may feel that it's gone a long time, but actually in the great scheme of things, it will go very quickly.
It's a very, very small part of your baby's life. So things like, doing the hoovering, doing a shop, doing an online shop, going off and taking the baby to the park once feeding's a little bit more routine. Let your partner have a bit of a lie-in one day, and then she can let you have a lie-in another day, so that you can share sleep, and don't go either. If your baby sleeps on a reliable basis in the daytime, then both go to bed and have a cuddle and sleep. Take your clothes off, go to bed, close the curtains, turn your phones off, and stop answering the door. Just go to bed and sleep, because it's such an important part of your coping is to have enough sleep as well. And that's the biggest thing I think that creates tension in relationships, is the exhaustion and the lack of communication and the expectation of roles changing. And I think that partners can feel very left out suddenly, because this baby is zapping every minute of your partner's energy and emotion and care, and you feel really left out of it all. So go back in there and be part of it, and become a 3 or a 4 if you had 2, or a 5 if you had 3, but just find time to make it work for you, so that it doesn't create that tension that you find is really stressful, and make the transition to parenthood a little bit easier, because there's so much you can do apart from feeding a baby. It's not about giving a baby a bottle.
We see some fabulous teams, don't we, working together, and it's really brilliant when couples work together and appreciate each other. It's
with
fantastic.
breastfeeding, to get pillows and things ready, and to look at if there are struggles with feeding, and if we're not at this time, if you can't be part of a one-to-one feeding support session, get yourself on the end of the phone and listen to the conversation that's going on, so that you can hear what the person's saying to support the breastfeeding skills, so that when you'd have to come and help, you can replicate that, or get a video of the baby attaching to the breast. We can do video pictures of the support we're using, so that you can see what's happening, and that will help you, and then you can support them doing that.
Or attend anywhere appointments allow for that, and that works really well. In fact, actually, partners are absolutely crucial in the attend anywhere appointments because they're the ones who are usually our cameraman or camerawoman. It's fantastic. Yeah. We've actually got some questions piling up, so I think we ought to be answering. First of all, I'd like to say, Michelina and Jenny, thank you very much for saying you can hear us. We're very grateful. We do like to know that you can hear us. Shannon was the first one in, and she's now nearly 36 weeks and thinking of doing breast and formula for feeding. Any tips or advice when it comes to doing both? Well, I think the first thing we'd say is to establish your milk supply, because you can add in formula later. But it is important to make sure you do have a milk supply in the first instance. So getting that baby to the breast as often as you can and doing any expressing if you need to, establish your milk supply, and then you can start thinking about adding in formula if that's what you end up doing. But it's very difficult to increase, and we've talked about this numerous times on this, it's very difficult to increase your milk supply later. So if you can establish your milk supply in the first couple of weeks, then you can think about when or what times you want to start adding in something else. But getting your milk supply going initially is crucial, otherwise you may not have that choice later. I don't know if anything to add to that.
No, I just think, it is a choice that you have to do it, so make it work for you. But yes, as Alex said, it's really important to establish your milk supply, and then you can reduce it, and then if you change your mind you can always get it back. But if you don't stimulate your breasts in the early days, you can't do anything about that later. If you want to make more milk and you suddenly think, actually I'm really quite enjoying breastfeeding and I'd like to do a bit more of it, and the option is taken away from you. So if you actually establish the milk first and then play around later on and do what works for you as a family, then that is, you've got choices. You can go up and down with your supply then, and you can bring it back and take it away. And actually that leads me on to a conversation I had with a lady today, this week, came to see me. Her baby really was, she'd been in hospital so we could see her. And she said, I didn't know, nobody didn't realise the importance of stimulating my breasts in the early days. I didn't realise that if I didn't do it, I'd be struggling like I am now. And her baby was about 2 or 3 weeks old, and she was really lower supply than she wanted to have, and she was having to work really, really hard to get her milk back, which involves triple feeding. So it's breastfeeding the baby, then pumping and topping the baby up, and that was 8 times a day.
That's
and all she was doing was that, and it was one big long cycle of that. And she said, if nobody, we do tell you, we really do tell you on the ward, we say protect your milk supply, hand express and skin to skin, and it needs to be done yesterday, not tomorrow. And most mums say, I'm too tired today, I'll do it tomorrow. And actually, if you say that 2 or 3 days in a row, your milk will not be there when you want it. So when we say protect your milk supply and skin to skin and hand express to stimulate your receptors in your breasts and stimulate the hormones from your pituitary gland in your brain, we mean it, because you have the clock starts to tick when you have your baby, and it stops ticking at about 2 weeks. So that's your time frame that you have when you start to produce milk. And if you don't use that time frame well, so you don't stimulate, you don't do the hand expressing, you don't do the regular breastfeeds, you leave your breast for long periods of time and introduce bottles, that's what your breast learns that you need, and the supply is not made, and it shuts down at about 2 weeks, and then you can't make more. So if you haven't done early good skin to skin, some mothers can, there's always an exception to a rule, but a lot of mothers will be struggling, and I know there will be quite a lot of women on here listening to what I'm saying and saying, yes, screaming at me, saying, yes, do it, because they didn't. Or they were too tired one day and they missed it, or they didn't realise they had to do it, which is much more important. So raising the awareness, and if you've got friends or family that are having babies, tell them that they have to do skin to skin and stimulate their breasts. So early, 2 or 3 days, it's hand expressing, and that's frequent, 10, 12, 14, 15 times a day hand express. Just do little bits all the time, because you're priming your receptors and you're plugging everything in to switch on and to start working, and you're calibrating your milk supply for 3 months' time. And so if you don't do that now, it's not there. And so we say it until the cows come home. We say hand express, skin to skin all the time, and then go on to pumping if the feeding isn't quite established or your milk supply isn't coming as quickly as you want it to. Keep going and just pump, or feed first. That's obviously the option. get lots of support, but do lots of stimulations in between, because you will get payback and your milk will come, and you will have lots of milk, and we can help you with lots of milk, but it's much, much harder to help you when your baby's not feeding well and you don't have lots of milk. And I know there will be lots of mums listening to us today that know exactly what we mean when we say that. So when she said to me this week, I said, right, I'm going to talk about that today. I'm going to say, you don't realise how important it is that you have to do it yesterday, not tomorrow, and really work hard and make those hormones work for you, and then think about it afterwards when you're exhausted. But you will be exhausted, and it really is hard, but you get payback and your baby gets milk, and then everybody leaves you alone and you can start going out and having a nice time with your baby instead of coming and talking to us and having consultations and chats about poor supply. So really, really, really listen to that, take it on board, and if partners are listening to this, remind your partner when she's in hospital and she's had her baby, tell her to keep hand expressing and pumping, because she will make lots of milk, and then she'll be very, very happy.
And she'll have lots of choices.
Yes.
I'm just going to do a reminder that this is the infant feeding session. I can see some questions coming up, which we'll do our best to answer, but we are the infant feeding team, so we are predominantly here to answer questions about feeding. And I know there are a few coming up that are not about feeding, but we'll do our best. So Sophie has said she's 25 weeks now, and she's thinking about giving birth, and she wants to know if her mum and her partner will be allowed to be there in October. At this moment in time, it is one person. You're allowed one person with you. We don't have any go-ahead to have anything more than one person with you at the moment. Visiting, as some of you will know, has opened up a bit. And if you're in for more than the 24 hours, then you actually can get a visitor on the day that you're neither arriving nor leaving. And that doesn't have to just be your partner, but it is one visitor, one day, for 1 hour, and that's
by appointment.
Yeah, it has to be by appointment. So in the mornings, the names are taken of who will be coming. There'll be someone on the door who have them in. So I think today the visiting was 2 till 3 here on level 5, and each floor is slightly different. Anyway, moving on. So Sophia, at this point in time, I can't tell you, I'm sorry, but definitely one person will be allowed with you. Noor has said, when her baby is born, will I be able to get someone to check if my baby has a posterior tongue tie as soon as they're born? Who would be the best to check? I suffered hugely with mastitis for 4 months, on and off with my first, to then discover he had a tongue tie. Well, that's where we come in. So we don't tend to look for tongue tie in the first instance, but with your history, I think we would have a low threshold. We know that a baby can be born with a very obvious tongue tie but feed just fine and have no problems at all. It's not what we can see, it's what the baby does with their tongue, how well they can move their tongue, how effectively they can remove milk from the breast. It isn't to do with what we can see. But no, get in touch with us, ask for us to be involved. That is very much part of our role, isn't it, from the point of view of looking at tongue ties and things.
Good feeding is good physio.
Absolutely.
For a tongue. So good feeding help and support, and so we can get involved if you've had that issue in the past. Your resistance to having problems will be very low, so your threshold will be much lower than somebody who's not breastfed before, because you know what it was like. But also, if you have good feeding and your baby is allowed to use what it's born with, it often is that's all that needs to be done. And I think if somebody says to you, your baby's got a tongue tie, and that's all they say, then it doesn't mean anything at all, as Alex has said. So it doesn't mean that your baby needs to have a tongue tie assessment if everything's going well. It just means that they can see the frenulum, and that's all. And we've all got them. Everybody has a tongue tie in various forms. It doesn't mean that there's going to be a problem. And I think that's where people trip up, because they think if they see a little line underneath the baby's tongue, it means that there's a problem, and it doesn't at all. If we saw 100 a month, 90 of those we wouldn't do anything at all about, apart from help with positioning, and only maybe 10 of those would need a little bit more extra input. So don't think that if your baby's got a visible tongue tie that it's going to be a problem to breastfeed. Don't make it a red herring. Good positioning and attachment, good breastfeeding support is the thing that you need to do, and that's always what we will do first before we do anything else at all. We won't look, we'll just watch what you do and see how your baby moves its mouth and feeds at the breast and transfers milk. That's the most important thing, is can your baby use what it's been born with? And then we'll move on from there.
Georgina's put a question up saying she's nearly 37 weeks and not producing any colostrum despite several attempts. Will this impact my ability to breastfeed when the baby arrives? No. I can see Naomi's already shaking her head. No, not necessarily. No.
Doesn't mean anything.
No. Some women can never express, even when they've got a full milk supply, they cannot express. But the baby can do just fine. So no, don't worry about that for this point, Georgina. Please don't be disheartened. Come in with a positive attitude, and I know we've talked about this before. Come in with the belief you can do this, and you will. You will be incredibly fine.
And it's improving your skills. You know, what you're doing antenatally is teaching you how to use your hand expression skills. And so when you need to, when you're tired and your baby's waiting for food, is that you have that skill already.
Yeah.
So watch and wait.
Naomi has come with a question. She's saying, any advice on VBAC? I'm still waiting to hear from the team to talk about my options. I'm afraid I'm going to have to say, we'll forward you back to the VBAC team because they're the specialists on the VBAC, I'm afraid, that we wouldn't be able to comment on that. We're the specialists in feeding. So apologies, Naomi, I don't think we can help you with that one. If you want to talk to someone, there is obviously the Ask the Midwife line. You can give them a call and see if they can chase up what's happening with your appointment. So do by all means try that. That one might be well worth having a chat with one of them, and they may be able to get some more detailed information for you in the meantime. So sorry not to help you more, Naomi, on that one. Amy has said, I'm booked for a C-section in September. I was wondering how latching for breastfeeding afterwards will be as easy as after a natural labour as I breastfed my other two after labour. It will be sorry, I always get, when there's an extra bit on, I always have to go back to find it where I was. As I breastfed my other two after labour, I was a bit worried about how it would be after a section with latching and skin to skin. Well, actually, our doctors are amazing at facilitating skin to skin. And the midwives in theatre. So a lot of mums are now getting skin to skin at birth. And as yours is obviously an elective section, then hopefully you may even have the opportunity for them to leave the cord pulsating for a little bit, rather than cutting the cord instantly when the baby's born. So just make what your wishes are, make them available to everyone, make sure everyone knows what you want. But I know that we have an increasing number of babies that are placed skin to skin after a C-section from now on. And then obviously when you go around to the recovery area, then the baby would be skin to skin with you then. But yes, at birth, we see a lot more babies skin to skin than we ever did historically. So I'm hopeful for you, Amy, that you will still get your skin to skin.
And also we do know that maximising skin to skin in that first hour is crucial for milk supply. And so facilitating that is really important for that too. So hopefully, prolonged skin to skin, and when you get to the observation ward after you've had it, then absolutely, continue doing the skin to skin as much as you can with the hand expression or helping your baby attach to the breast, and the staff on the observation ward should be able to help you do that as well. Remembering that your baby will be alert in that first hour more than any other time. It's really crucial if you can do that first feed early.
Francesca has said she's apologising, saying that we talk about poos and peas a lot. Well, we don't mind. It's I won't say the bread and butter of our business, but it is really important because obviously it does. Because if a baby's taking something in, they're going to send it back out the other end. So actually, it's really indicative.
We get lots of poonamis.
We love babies who poo a lot because we know they're getting lots of food, which is always very good.
We don't need to worry about them.
But she's saying that her baby's now 7 weeks tomorrow, exclusively breastfed. Normally does lots of nice runny poos. Hasn't done one yet today nor yesterday. Should I be worried? She had plenty of wet ones. Never been worried about her weight. Thanks. Well, actually, we know that when you get beyond 6 weeks, it tends to slow down. So babies poo slightly less frequently after 6 weeks. So to be honest, Francesca, at this point in time, I wouldn't be concerned. As long as her tummy's still nice and soft and she's comfortable, then we wouldn't be concerned at all.
Plastic sheets.
But when it goes, when it happens, yeah. We know that babies that are breastfed don't get constipation, so we would not be worried about that at all. So I would anticipate you will see a big poo soon, and that might be what she does from now on. You might find she goes a few days without pooing, and that's as long as she's gaining appropriately and weeing appropriately. We've got no concerns about her at all, Francesca. I hope that reassures you. Jessica has said, I'm due for an induction tomorrow morning. We'll be thinking of you. When will I move to the delivery suite, and when can my husband join? I'm really sorry, Jessica. I don't think we've got the information to answer that one at this moment in time. It usually is when you've gone into established labour, and that obviously is dependent, totally dependent on you and your body as to when you go into established labour. You will be guided by by our colleagues on the induction suite. They will keep you, updated as to what's happening, and obviously you'll be able to contact your partner. But more than that, we couldn't say, I'm afraid. But so, Jessica, we're thinking of you tomorrow, and let's hope that induction works nice and quickly, and your husband can come in nice and quickly and join you.
And if you have time, you can do some hand expressing. That might get things going as well with the induction, if you feel comfortable doing that. And I'm sure the girls will talk to you on the induction suite. But good luck. You'll have a lovely day.
Michelina has come back again saying, hello ladies, like you said, the hand expressing is very important. Before I decide whether I need a breast pump, can I hand express straight into the bottle so my partner can feed too? Sorry, I'm a first time mum to be and have no idea what to use to store the milk in, etc. Thank you. It depends on how much you're expressing as to what you store it in. And some women are absolutely amazing with their hands and never need to use a pump, but others find a pump easier. So it really is whatever suits you best. In the first instance, though, when you're hand expressing, either when you're still pregnant, i.e. before you have your baby, or as when the baby's first born and it's colostrum, we would be talking about syringes or just tiny little egg cups or something really small, a teaspoon. So because colostrum is a small amount, it's a food in concentrate. So it really depends at what stage you're expressing as to what you would want to store it in. Storage could be ice cream cubes, it could be Tupperwares, it could be special bottles, whatever can go in, plastic bottles could be used, and it can be freezer bags as well. So there's plenty of choice out there for you, depending on when you're doing it as to what you would need. For those that decide to do expressing in the antenatal period, we would normally suggest that they have some syringes to do that into. If you're expressing when the baby's born and it's still in the colostrum phase, a teaspoon would be just fine. So, anything else on that? I think that's about it, isn't it? Hope that answers your question. Lisa said, I've breastfed since my baby was born 2 weeks ago. Well done, Lisa. And my breasts have been fine since my milk came in. Now it feels like my breasts are coming in with milk again and heavy. Is this normal? They feel so full. I alternate every feed. It might be worth thinking about offering both breasts at each feed. We would normally say both breasts at each feed is a full feed. So it's like offering pudding, and you might find that you actually feel slightly more comfortable if you're offering both breasts. So the rule of thumb is to put the baby to the breast, let them finish what they want. They come off. If they're looking for more, you offer the second breast. And then that would be both breasts offered at a feed. It's like being offered pudding. It's nice to be offered pudding, so always offer the second breast. And then both breasts will be stimulated at each feed, but actually it will regulate as well, so you don't go long periods of time between offering one breast. So if you imagine you've offered your left at 9 in the morning, and then you offer your right at maybe say 11:30, by the time you get back to your left, it could be mid-afternoon, and that's a very long time to leave your breasts, which might be why you're feeling quite so full. So perhaps I'll try offering your baby the second breast at the feed, and see if you feel a bit more comfortable that way.
It might be that your baby's been a bit more hungry in the last couple of days, and you've just upped your supply because he's asked for more, and it might settle down again. Tends to be, your supply is regulated, and by about 2 weeks it starts to take over sort of the normal production and supply. And so you've probably done lots of really, really good stimulation in the early days, and you've secured a really good supply, which takes up to about 6 weeks, but actually the first couple of weeks is the most crucial one, which has calibrated your supply. And as I say, if he's been a bit more unsettled in the last couple of days, it might be that you've just upped your supply a little bit more, and his needs are going to be met in the next few days, and then he'll start to have another bit of a feeding frenzy and make more milk again. And that's what tends to happen, is they feed well one day, they sleep the next, and then they feed well one day and sleep the next, so that your supply is constantly changing. It's not always the same.
So I has written, I was told to breastfeed on demand, however my baby's asking every half hour when he's awake, although he occasionally sleeps for up to 3 hours. It ends up on average being 20 feeds in 24 hours, and he seems to have a lot of trouble with gas. I think I have a big letdown, which may be to do with the gas. So I think it's a case of thinking about and we talked about offering both breasts, so 2 breasts would be 1 feed, and even maybe a 3rd breast. You could go back to the 1st breast again and still be 1 feed and see what happens. You haven't mentioned what the poos are like, because the gas, maybe your baby's got some green stools. It might be worth having a chat with someone just to see how that positioning attachment is going. Is your baby going on well enough to get a really good balance of milk, the watery milk, the higher fat milk, to really settle your baby's tummy? Because if that's not happening, we do end up with babies with very gaseous tummies, very unsettled, coming back to the breast frequently. So it may be really well worth giving us a shout, Ira, and maybe we could do an attend anyway. Yeah, Naomi's going to do a little bit of positioning attachment just to...
Just trying to do back to front here, so I have to make sure you can see what I'm doing, and then keep social distancing as well. I've got to get myself right round here. So make sure that your baby is tucked well in. Do I stand up and do this? It might be...
Okay.
There we are, that's better, isn't it? So your baby is tucked well into you. Can you see how close your baby is? He's really close in, all the way round and comfortable. And then look at the way that your breast is lying. So if your breast is upright, like that, then your baby needs to be much more in line with your tummy. If your breast is down here, can you see if you do that, the breast will fall out of his mouth. So you need to bring your baby round to work with the angle. But all the time, going round the right way, your baby is close, very close. You're holding the back of the baby's shoulders, and the heel of my hand is just between the shoulder blades, and my hands are off the head, because your baby needs to be able to take its head back. So it sniffs the air, so the head comes up and sniffs the air. And then you line your baby up with the nose at about the level of the nipple. And then your baby's chin is really close to the breast here. So basically, this is your baby's chin, and this is the nipple here. And so your baby will be asymmetrical on the breast. So its chin is right underneath here on the breast tissue. And the nipple is just skimming your baby's gum. So it's literally just skimming over, and the baby will take the breast into its mouth and go to the back of the roof of the mouth. Can you see that? And so that the baby's then taking milk from deep within the breast. Now, if your baby is going on centrally like that, it's going to be a much shallower latch, and it will get lots and lots and lots of lactose. So it'll get lots of sugary milk that will quench thirst, but it won't fill. That's not your cheese and biscuits and your after dinner mint. This is your cheese and biscuits and your after dinner mint, where the baby can really strip the milk from right deep in the breast. So it might be that you're going from a central latch to a deeper latch like that. So your baby's coming up slightly more underneath the breast than you are doing. And so that he's a little bit closer to you, and he's sniffing the air. The other thing you could do is just tweak your nipple back very slightly. So you're pulling the nipple back very slightly, and that just gives more of the underside of the breast for your baby to get to. So his chin can hit the breast lower, and then you let go and let that baby take a big mouthful in. And if you have somebody with you that can just sort of dribble milk all around your nipple area when you're feeding, so you can with a teaspoon you can trickle a little bit of express milk around, so that there's a constant stream of milk going around the baby's mouth. He'll start to lick, and then when that happens, he'll start to open his mouth and put his tongue down and go onto the breast a little bit deeper, so that and make sure when you're putting your baby on the breast that you're actually using the heel of your hand to actually support the baby and take it up from his shoulders. So it's almost like a butterfly opening up. He's moving his shoulders back, so he's going back like that, and his chin will go forwards, and then he will be able to open his mouth up and go onto the breast. And what you don't want to be doing is nosediving your baby, so you're not lifting him up and putting him on, which is what a lot of mums will do. And then what happens is they're feeding at the nose, and the baby is much further away from your body. You want the other way round, so that your baby is close and the nose is sniffing the air, and the chin is leading, and you're using the heel of your hand to support your baby forwards as he gapes, so that he goes really firmly on and takes a really big mouthful to the back of the roof of his mouth. And that should secure a deeper latch. And hold him there, or her there, hold them, and make sure that they sustain that latch till they get sucking. Babies hate change, so they will object to it if they haven't done that much. They will start telling you not to tell me what to do, but actually they'll realise that it makes life much easier, and that they are able to get more milk and enjoy the feed much more. So try that and see if that makes a difference, just to get slightly deeper latch.
We just know that positioning attachment, just 2 millimetres can make a really, really big difference, Aya. So it is well worth having a look. If you're struggling, then you can get in touch. We can talk you through it. We can attend anywhere. And there's obviously, and we mentioned it on these sessions before, the fabulous Oxfordshire Breastfeeding Support Group are doing an amazing job out there with Zoom appointments, as are the Abingdon Baby Cafe. So there's plenty of support out there for you. And get in touch with us or them, and we will see. Because the likelihood is just a tiny change in your positioning attachment will make a big difference for you, Aya, for you and your baby. Leah's message. Leah's one of our regulars, and we've met her. So she's just saying how useful these sessions have been, which is really lovely. She's been watching every week, and her baby's now 10 weeks old.
Oh,
amazing, yeah.
Well done, you.
And she knows how fragile the milk supply is at the beginning. But when it does become that bit more robust, when does it become that bit more robust? I get really worried about the length between feeds and if this is going to affect my supply. At night, her baby sleeps really well. She has a second formula bottle of the day around 7 p.m, then cluster feeds through the rest of the evening on me, usually 7 p.m, and then usually followed by a 7+ hour sleep. Wow, that's a long time, Leah. When she starts to stir around 5 or 6, I feed her in bed before getting up for the day. Is this length of time too long? Then during the day, she has her first bottle feed, which will leave roughly 5 hours between breastfeeds. We seem to be in a really good routine that works for us, but I'm worried that it's a bad routine for keeping up my milk supply. Hope that makes sense. The rule of thumb, Leah, is we wouldn't normally go more than 6 hours between milk removals, which is why I was mentioning earlier about if you're feeding on one side, you can easily get to 6 hours. If you're doing one breast, then the other breast at the next feed, back to the first breast, then actually you can hit 6 hours quite easily, and that can impact on your supply. So I think my temptation would be to say not to go more than 6 hours, and maybe try and fit in I don't know, a pump session, a feeding session or whatever, so that she doesn't go quite so long, because that might impact on your milk supply in the long run. The only thing to say now, though, is once your milk supply is established, that once it's established, if it drops, you can get it back up again. The period of time where you make the biggest difference, as we've always said, is the first 2 weeks. Once it's established, if you then after that have a bit of a drop, and then you push it back again, you can do that. You can go back, but you can't go higher than you were before. So that's the thing to bear in mind. So just be careful about your 7+ hours. I think on that one, your 5 or so hours, less of an issue. But have a rule of thumb in your mind of 6.
And 8 feeds in 24 hours minimum for a breastfed baby really is what you're looking for. And obviously, if your baby is going through the night, and some babies do that. You can't wake your baby up to feed it if it doesn't want it, and also you've got to look. Well, you can do if the weight's not great, but if your baby's gaining lots of weight and everything is okay, and we've said that don't panic if your baby is doing that and you've got plenty of milk. But if you're looking at your milk supply and you're worried about your milk supply, and you're also using bottles, you're going to drop your hormone levels down, and that will reduce your milk supply. Yeah. So are you doing 8 feeds in 24 hours, and is your baby reaching its milestones? That's the most important thing to look at when that happens.
Yeah. So Liz added as well that she said that these have been one of the most useful things to access these sessions, and I think that would be a good tool to carry on after the coronavirus, but we've actually said that as well. I think it'd be quite good. We'll see what happens. And she wished this sort of information, this quick question and answer sessions were available when she had her son. Thank you, Leah.
Lovely
very
feedback,
much.
Thank you.
Amy's come back and said thank you again. Thank you as well. Thanks, guys. She's gone. Francesca said thank you. I wasn't sure what to expect now. She's that few weeks older. I'll prepare for a nice big one soon. Yeah, it's one of those occasions when you know it's coming, you don't want her on your lap. Lift that.
Don't do it on the duvet.
Moving around quickly. Lisa has said, what can I use to ease the ache in her breast? Thank you so much. I'll try both in one feed. Cool is quite handy, actually. Cool compresses are good. I mean, you may have heard that people use cabbages, Savoy cabbages in the fridge. I mean, they're nice shape, they're the right shape, and because they're all ridgy, they hold the cold for a bit longer. But it doesn't have to be that. Anything cold. It could be a cold flannel. It could be anything really. Just something cool on the breast will help them, will ease them. If it's really bad, you could be trying some ibuprofen if you are all right to take ibuprofen. But that's really good for inflammation as well. But cool compresses would be a good thing to try, Lisa, with your breasts if you're beginning to feel a bit full and uncomfortable.
And revisit your latch. It may be that the milk removal is not as efficient as it could be, and there's a bit of build up inside your milk ducts. So it might be that a slightly deeper latch might support that as well.
Yeah.
Just so that you are draining your breasts well when you're breastfeeding. It might be that you need to go slightly deeper to help the transfer of milk.
Claire's come on and has said, at what point before the baby's born would you start hand expressing? And sorry if we've answered that earlier. Don't worry, we haven't today. We have on other occasions, but not today. We would suggest that you start at about 37 weeks if that's what you're thinking you want to do. You don't have to. It's not obligatory. There are some women for whom it's really beneficial. So our mothers who maybe have diabetes, it's really useful to have some colostrum in advance because their babies might drop their blood sugars in the early hours after birth. So we do suggest that for them it's really beneficial. And if you would think there's any risk of your baby not being very well, some mothers who maybe know the babies will have to go to special care, expressing in advance is really useful. But it's not obligatory. You don't have to do it. Many women don't do it. But if you want to do it, 37 weeks onwards, and there's quite a lot of information out there about it on the latching, on Association of Breastfeeding Mothers, have all got information about expressing during pregnancy.
I think the important thing to say is if you do lots of antenatal harvesting and you have a really good stash of colostrum, don't forget to do it.
Yeah.
Even if you've got a massive stash, don't think, oh, well, I don't need to do it because I've got loads of colostrum for my baby. You have to do it regularly and stimulate your milk supply after you've had your baby to put that order in. And that goes back to your first 2 weeks and doing frequent stimulations of breastfeeding and or hand expressing in the early days in order to maximise your milk production. So don't rest on your laurels if you take a wadge in with you or you have a wadge in your freezer at home. Perhaps don't take it all with you in labour when you go in. Leave it at home.
I suppose not even perhaps. Please don't bring it all in with you because unfortunately it defrosts, and once it's defrosted we can only keep it for 12 hours. So we're 24 hours, but we just don't want you to bring it in and it have to be thrown away. It's so sad. Only bring in a small amount.
Just 1 syringe full or something in a freezer block. In a bag in a freezer block, and then you can use that. But don't rest on your laurels because you've got a wadge of it. You really have to switch your receptors on and start hand expressing and breastfeeding as early as you can and as frequently as you can in the early days.
Michelina's come back saying thank you. She's 38 weeks and might start practicing hand expressing. I forgot to pick up the syringes from my midwife during the 36-week appointment. Where can I get these from? Where can I get them from? And how long can I store it in the fridge for? Sorry, I know we've talked about it in the past, but baby brain kicking in. You could actually maybe just give your midwives a quick call and see if they can pop some in the post to you. And you can store it in the fridge for up to 5 days. So if you want to, you can then you could put it in the freezer. So as we were just saying, if you want to bring it in a cool bag with freezer blocks is probably the best way of bringing it in, and don't bring too much in, please.
You could also use a teaspoon to collect it and put it in little ice cube trays. So you can get mini ice cube trays and you can put it in there. So if you just put it in a clean ice cube tray and then put it into a freezer bag, so it's inside a bag in the freezer, then you can just add to it and then break out the little blocks that you've got of colostrum that you collect. But don't expect to fill them because it's only small amounts. You might do, but don't expect to. It might only be 0.2 ml that you get out, and that's completely normal. You might just get little glistens when you do it and nothing else, and that's also completely normal. You might get 1 ml, that's also completely normal. So don't panic whatever happens. It's learning the skill that matters more than anything else, and then if you get colostrum on top of that, then that's the bonus. But you're learning a skill, so when you have to do it, when you've had your baby, you've got that skill in place.
Absolutely. Great, much better to learn it then. Aya's come back with an update to her earlier question. Lots of yellow seedy poos and really good early weight gain. Brilliant. He doesn't tend to feed for very long. He'll stop after 5 minutes, even less sometimes. So I often try to keep him on the same breast if he asks again for a few minutes later, just to make sure he gets hind milk rather than off for the next breast. I think someone's about to come in the room. Hello, we're in the middle of a Facebook Live.
You're on telly.
You're on telly. We didn't put a note on the door today, we forgot. Right, so I've got brilliant news about the seedy poos, really good news about the early weight gain hour, that's all fantastic. Some babies can do what they need to do in 5 minutes, but obviously you're getting loads and loads of feeds here. I still think it might be worth having a chat with one of us, just make sure your baby's getting as deep a latch as they can do, just to really give them that opportunity to really milk the breast well, and then maybe you might get slightly more of a gap between feeds, because that is a lot of feeds. Sometimes babies are just, a lot of it is comfort as well, and I think that's something we've talked about loads in the past, is that a lot of feeding is comfort. People think,
just about food.
Yes, exactly, it's way more than just food, isn't it? So there's so much more going on, and it's the babies checking in to make sure you're there and that you're going to meet their needs. It's about trust. And it's trust, it's them knowing that they just want to know you're there, and that you're their caregiver and you're still there and you're going to meet their needs, and they learn over time that's the case, and they can go longer periods of time. So it's a trust relationship going on there. They're learning about you. So but it may be worth getting someone to have a quick peek eye and just see if we can make it even better for you. Great news about the poos and weight though. Maisie Cope Steak, we know your name. We've come across you before. Hello, my baby's coming up to 5 weeks and is definitely gaining weight and feeding regularly. Still too early. I think I might have an oversupply issue. How can I rectify this? Even with, this is one of the bigger ones I have to go down. How can I rectify this? Sorry about this. Even with feeding every 2 hours and often with both breasts at one feed, I often have leaks and feel engorged. I've tried pumping off, but I don't want to make the supply issue worse. Also, when I will feed space out a bit, I'm exclusively breastfeeding at the moment, finding it quite draining while trying to keep up with 2 older children. So let's just recap on that then. So 5 weeks now, gaining weight well, bit of an oversupply going on, feeds every 2 hours, often with both breasts. Again, I think we might need to think about positioning attachment. What do you think?
Make sure that you can't get your baby slightly deeper. Remember, it's not quite into the 6 weeks where it takes to establish your breastfeeding, so it might be over the next couple of weeks that your supply will damp down a little bit anyway, because the order you put in the early days was obviously really good, and you've got a really healthy supply of milk. It might just be that the milk retrieval is not as good as it could be, and it might be that you just need to work just to go back to basics again and see if you can improve that in any way. It gets harder as they get a bit older because they really don't like change, and they will fight you to not go on the breast properly if they've been on the end. But just try and alter the attachment slightly. It might be that you need to tweak it and bring your baby a little bit closer into you and a little bit further round, so that they're getting more of the breast and less of the areola and at the bottom in their mouth. So just have a little look and see if if you can make any tweakings and change anything in that one.
I think one of the things that we often see, and not uncommonly at this sort of age, is that the babies have grown a lot, and parents and mums are not necessarily allowing for that extra length and still putting them in the same proportion to their body. So actually, remember, start nose to nipple. Start that baby nose to nipple, and then you'll have a lot of baby going off to your side, and that's fine. But it's allowing for that growth, because I think sometimes we don't allow it, and then the baby doesn't come to the breast, as Naomi demonstrated earlier, with the chin leading, because they can't, because they're too far across you and they actually need to be further around. So sometimes that can make a big difference, just remembering that basic of nose to nipple.
And you might not be sore because you've been doing it for a while now, and you just might not notice that it's not quite right, but actually sometimes you find that when you've done it in a certain way and then you put them on right, you think the baby's going to fall off your breast because it doesn't feel like it's in the right place, but actually it just might make a difference, and you probably will say, oh yeah, that feels better. And actually it was a little bit uncomfortable, but you hadn't realised because you've got used to it. So it is worth just doing something different, and it might make a change in behaviour and settle your baby down. A millimetre can make a difference between frequent and less frequent feeds.
Iris came back and said, thank you. She'll try the positioning tips. We did have a lot of early problems with painful shallow latch, and now I think I might be a bit nervous to change it if it's not hurting, given how hard it was originally.
Yeah, I get that.
Yeah,
we
totally.
Hear what you say.
Have to try though, see how you get on. You might really pay dividends.
Yeah.
Michelina's come back, wonderful, thank you. Claire's come back, so thank you, and thanks for all the help I had from the infant feeding team with my 2 other boys, thank you, Claire. Alex, you helped me immensely with my second born in September 2017. Oh wow, lovely. So that's nice to know.
Well
we always
done, you.
we like hearing about it, so hearing how you got on as well. So we always hope when we don't hear any more from you that you've gone off and things have gone really well, so it's nice to hear back. Becky said, hello, I'm due in 7 weeks and last had to breastfeed 12 years ago with my second, which ended in disaster, and switched to the bottle after I'd given up birth. Will there be anyone to help me with positioning, etc., as I feel like a new mum all over again before I go home? Also, I know to remove any piercings before feeding, but would this cause any problems with feeding? Yes, you will get help. All our staff are trained to help mums with breastfeeding, whether you're down on delivery suite, whether you're on observation area, level 5, level 7. Everyone is trained in the community, midwifery-led units. Everyone has been trained to help with feeding. The only time I'm dropping things on the floor, it's my goggles. We get rolled in when there's a problem, a particular problem. So I always say to when we're doing these, I say, you may not see us, and that's the best thing going, because we only get pulled in when there's a particular feeding problem. So most of the people who come through the hospital don't ever see us, and we just see a few people. So there are lots of people out there that will be able to help you, or here that will be able to help you in the hospital. They're all trained to help with positioning, attachment. They all understand about feeding and how to support mothers. But if you have a particular problem, anything that's slightly different,
they're also trained to pick that up.
Yes, then
So
they should involve
they will call
us. Yeah, they should
will
involve
call
us.
if they feel that you need to see us. And then we may well just give them some advice on the phone, or we may then see you in person.
Yeah.
But hopefully we don't need to see many of you, but we're there to support. And you can also self-refer if you're not getting the right answers. You can ring us and talk to us as well.
So I'll just say, Becky, that you obviously had a really difficult time last time. By all means, give us a call and we can have a chat about that and see what happened last time, and then see if there's anything we can help put in place to try and preempt that.
You not really reduce your anxiety more than
not have to go through it all again.
About it too much.
Exactly. We're very happy to see people virtually in the antenatal period. We talk to mums who've had surgery of the breast and chest. We talk to mothers who have had previous breastfeeding problems, who are on medications that might be contraindicated. So we do talk to mums in the antenatal period. So if you think that it would be beneficial, then give us a call and we can talk through what happened last time, and maybe we can put a plan in place to help try and avert that happening again this time. I hope that helps. That was our last question that we've got so far, so I don't know if anybody's got any more. We've done 51 minutes, fine. I think we've had enough of us talking.
Yeah, I think so.
With tea breaks and glasses on the floor.
So I hope you found it helpful, and think about some questions, think about anything, and come back and tell us about positive things that you found, and what sometimes just talk about what your experience was and what you found the most helpful to get you. Share your tips with other mums so that we can talk about them online and just confirm what we're saying, because we can say it until we're blue in the face, but you sometimes don't believe us, and it's certainly peer support. So using the Oxfordshire breastfeeding support, La Leche League, other breastfeeding support in the area, they've got I think they've got drop-in type Zoom sessions now where you can have coffee mornings without having a breastfeeding problem, to meet other mums and talk about it. And the more that you go out and meet other mums and talk to other mums, the more normal you'll feel, because you feel like the weight of the world is on your shoulders when you've got a baby that is not doing what you want it to do, or not what your expectations were. And I think if you talk to somebody else that's a week or two ahead of you, and they'll say, yeah, that happened to me, but look what I'm doing now, it's so much easier, you'll believe them. But it's all very well for us sitting here. We've been in bed all night mostly, and but we are tried and tested with it. But actually talking to mums going through it at the same time with you, peer support, is really, really valuable.
Yeah.
So look at what's available online, look at the OBS pages, look at La Leche, see what they've got available that you can use. The NCT do things. And obviously you've got your own group of mums that you might have met antenatally, although that's less and less likely as you're going on in your pregnancies because of COVID shutdown. But hopefully you can get a network of friends and family that will tell you what their experiences were. That might not help you sometimes, but some people will give you some very helpful tips. And don't feel that you're failing if your baby's not doing what your friend's baby's doing, is the other thing to say, because your baby's your baby. And the good baby does not sleep through the night on the first week. So,
or the second or
or the second or the third, or in 6 months sometimes. So, don't define your baby as being good if it's not feeding very frequently. Think about what your baby's and your needs are and how your baby's behaving, and that's really important.
That's done.
So
thank you very much for all the questions again.
Same time next week, we'll be in.
All right then. See you then. Bye.
Have a good week.